This Good to Go segment is sponsored by Spectrum Health Medical Group.
Blood cancer is the uncontrolled growth of abnormal blood cells in the body. These cancerous cells prevent your blood from performing many of its functions, like fighting off infections or preventing serious bleeding. To better understand blood cancer, its causes, and how it's treated, we welcome Dr. Anas Al-Janadi. He is Vice President and Department Chief at Spectrum Health's Cancer Center. Good to see you, Dr. Al-Janadi.
Good to see you. Thank you very much for having me.
Oh, glad to. It's so important to talk about this. What are the more common types of blood cancers and how do they affect the body?
The blood cancers can be named a few different names familiar to people. So some people will hear the term leukemia, which is really when the blood cells mainly go crazy or become cancerous in the bone marrow and the blood. Lymphoma, which is the same, they're all type of cancer blood cell, but it depends on where they're located. And the lymphoma is when mainly those blood cancer cells are located in the lymph nodes. And there's a type called multiple myeloma that's also common. That's just also in the bone marrow mainly, but it has the bad cell called the plasma cell. And we can go a little bit more details about these cells, but those are the major type is leukemia, lymphoma, and multiple myeloma.
And what would be some signs or symptoms that might indicate blood cancer? That's a little tricky sometimes, isn't it?
That's true. As you started, when you started the segment, Catherine, you mentioned that it's really all the signs and symptoms mainly relate to the interference of the function of the normal blood cells. So we can divide them into, as you said, the infection, because these bad cells, cancer cells, that when they start to invade the bone marrow, then it interferes with the function of the bone marrow, which is bone marrow is the factory of the blood cells. So if it's not producing the healthy infection-fighting cells, then we have serious infections. So patients may have fever, chills. They come really with bad pneumonia and other infections in the side of the body. Patients could come also with signs of bleeding. It could be gum bleeding, it could be larger bruises in the body without like having any major any trauma or anything. We call them spontaneous, so they occur on their own. Some patients may also come because of signs of enlargement of the spleen, which it could show as decrease in appetite and has not been able to eat normal or regular portion of their meals. And those are all related to that enlargement of the spleen and or any lymph glands inside the body.
Is blood cancer treatable?
It's actually one of the most treatable cancers are blood cancers. And in fact, just back in history, chemotherapy was invented mainly for blood cancers in the 60s. So good news is not all cancers. Some of them we could watch. Some of them come in a milder flavor that we could watch them. But most blood cancers are highly treatable. Many of them are curable. And lots of them, we can put them into long-term remissions as well.
That's certainly good news. So do we know about who might be most at risk, or if there are ways to prevent blood cancer from ever setting in?
There are a few things that we know increase the risk of certain blood cancers, such as exposure to radiation, but that's really an excessive radiation, meaning not the daily one that, when we do our normal screening test every year or so. Those are really low dose radiation, but people who work mainly in radiation, that's why we have the safety, for instance, in place for radiation workers. People who are actually also work in factories, especially if they're exposed to industrial grade chemicals, such as solvents and other materials. And that's why safety is very important. Patients who have low impaired immune system, such as those who have, let's say, heart or liver or kidney transplant, and they keep taking what we call immune suppressive pills, right? Those pills that decrease control your immune system, those also at higher risk of certain blood cancers. But other than that, there are many cancers. They just happen, unfortunately, due to either aging process or unknown causes.
All right, we got to let folks know they can find more information about blood cancer on the Spectrum Health website under Cancer Center. I also want to let you know that Leukemia and Lymphoma Society is hosting its annual Light the Night. It's Thursday, October 6th on Calder Plaza in Grand Rapids, and it is an opportunity to gather to celebrate, honor, and remember those who've been touched by blood cancer, but also to raise money toward the life-saving research, advocacy, and support for blood cancer patients. All that information at 13onyourside.com. Dr. Al-Janadi, thanks.
Thank you very much, Catherine.